So, hello. This is Industry Insights with Cheryl. I'm Cheryl Dalton-Norman, president of Conduit Health Partners. And today I am so excited to have Andy Parham from Brado meeting with me today, and really wanted to pick your brain, Andy, and learn more about your thoughts about consumer engagement and really how health systems should be thinking about reaching the folks that they serve in their communities. So, Andy, welcome. And can you tell us a little bit about you and a little bit about Brado?
Sure, Cheryl. Thank you for having me. It's a pleasure. Brado's a 25-year-old firm. We'll celebrate our 26th birthday here very soon. And for 25 years, we have been conducting primary research into consumer health journeys. We've developed techniques over the years to not only understand the stages of those journeys, but the tension that people have in them and the key questions that they have and what great answers look like for them. In 2017, myself and my partner decided that we would expand Brado into digital engagement. And so the idea was if I understood the stages of a health journey, I could map the 1 billion questions people ask Dr. Google about those stages, about each of those stages. I could map keywords to those stages. And if I knew the tension in the journey, I could present a message that would resonate. And then finally, in 2022, we began a partnership with Bon Secours Mercy Health to develop a conversational AI engagement platform that would transform the way that health brands are able to engage with consumers in those journeys. I've been in consumer engagement and marketing my entire career, and I'm getting a little older in the tooth than I want to admit. So it's been a while.
That's awesome. That's awesome. And I'm really excited about the work that you're doing with Bon Secours Mercy Health. And really, as you speak about what you all do at Brado, it seems obvious to me why healthcare executives should care about this. But, as you're talking with healthcare leaders, do you find sometimes that there's a gap in understanding why folks should care about this work?
Yeah, so it's a great question, Cheryl, and there's a lot packed into that. The way that we think about it very simply is that if health systems can harness conversational AI, which is a transformational technology, and to engage with people early in their health journeys and then stay engaged with them in a personal way, in a way that remembers the previous conversation and can guide a person to all of the care that they need, then they can build really valuable relationships.
Yeah.
So this gets to lifetime value. It's patient acquisition. It's patient experience. It's patient retention, but ultimately it's lifetime value and delivering on the mission that health systems have, which is to be that local partner for all things health and to guide people to good help. And we think that conversational AI represents a new opportunity to do that in a transformational way.
Yeah. Yeah. So as you talk about conversational AI, what do you see as a significant barrier for healthcare executives considering this kind of work?
Well, first of all, the conversational AI entered the consumer zeitgeist in 23 with the launch of ChatGPT. We all witnessed the radio station being taken over in the United States by ChatGPT. But rightfully, most health system executives said, "Hold on, let's see how this develops because there need to be guardrails in healthcare. We have specific GDPR, HIPAA." Related requirements, and we need to make sure that we can control this AI. What's been exciting to see over the last many months is purpose-built AI, purpose-built for healthcare, for those privacy concerns, those regulatory concerns, with guardrails so that it can be harnessed. So that's the first piece of it. I
Mhm.
think the second piece of it is, in terms of a barrier, is that um, in healthcare providers, rightfully so, are very focused on clinical protocols, clinical workflows, and thankfully they are. But to engage with a consumer in a next level, we have to switch to think about consumer life flows. And it's different. And this is why that difference is why I think that the broader navigation capability industry in healthcare, which is, I read somewhere recently, by 2030, it'll be a $90 billion industry growing at a double-digit growth rate, fails. So I also read a study recently that 9 out of 10 Americans can't find the right healthcare at the right time at the right place. So, and I think a part of that is this discontinuity between being focused on workflows versus being focused on life flows.
Yeah, yeah. I know in my own family, my father-in-law has really been ill recently, and finding ways to stay connected and for the consumer not to have to chase it, but for it to be more easier to access and less work for the patient and their families. How do you see the work that you're doing making things easier for an individual or a family experiencing healthcare challenges?
Well, it's interesting that you brought up your own family.
Mhm.
And when we launched our conversational engagement platform with Bond Square Mercy Health, as you know, we focused on the family caregiver of people that suffer with dementia. And the idea there, Cheryl, was a couple of things. One, unfortunately, so many Americans are affected by that health journey, including myself. I lost my father to complications from dementia. And the family caregiver is relied on for so much over a long journey. And the clinical caregivers, as you also know better than I, are completely tapped out from a capacity standpoint. So, how can we harness conversational AI to increase the capacity of the family caregiver, which is going to be required across multiple health journeys over the next 10, 15, 20 years? And the formula that we found was a two-part formula. First is to train or fine tune the large language models on what's actually happening in that family caregiver's life. So we do the research, we understand the key questions that they have at each stage of that long journey, and we define with them what great answers look like. And then we create question answer pairs. We use AI to amplify those from hundreds of question answer pairs to tens of thousands, which can train an AI and present highly relevant conversation partner for that family caregiver in that moment. And finally, obviously, the conversational AI does not get tired, doesn't have a sick day. And so it's available 24/7, 365. And that's what family caregivers need, because I remember my dad in the middle of the night would get paranoid, and my mom would have to deal with that. And there are a host of other things. And her clinician wasn't necessarily available at 2 in the morning, but a trusted guide that can help her understand what's happening and what she might do next would have been really helpful.
Yeah, absolutely. And I think that's really amazing. I think sometimes there's this belief that a computer off somewhere with no engagement with any human being is somehow making this up. And what I hear you saying is, there's a lot of research, there's a lot of really testing and ensuring that the answers and the pathways that are shared with the consumer are vetted through your company, but also through those that you're serving, those health systems and those experts in care. They're looking and going, yes, this is right. This is the good answer. This is going to help somebody understand and know how to move through the process and get to the next step. And of course, continue to engage with their providers, the nursing staff, the doctors, therapists, others like that. So I think that's super reassuring to me as a family member thinking about that.
Absolutely. And the word you didn't use, but what you just described is trust.
Yeah.
And so we are very transparent with the consumer that this is brought to you by your local health system that you trust. And in order for it to be brought to you by that local health system, it needs to be trained by not just consumer journey data, it also needs to be informed by clinical protocols and the clinical team. And so we sit with And when we deployed that dementia journey with Bon Secours Mercy Health, we sat with all the relevant clinical leaders and said, okay, in this type of question, do we want to give a specific answer or a generative answer? Some answers we just want to say, nope, this is the answer. In this type of question, do we want to immediately guide a person to an expert like Conduit? Do we want to guide a person to schedule an appointment, or is it appropriate to continue to offer other resources in the person's life, and the conversation can do that? So trust is the name of the game, coming from your local provider, properly vetted, and then finally, every single question in every conversation, we are tracking, we are storing, we are assessing, we are optimizing to make sure that the conversation doesn't run off the rails, or as Leslie Stahl would say, hallucinate.
I love that. I love that. So, as we think about, and I've so appreciated hearing you talk about this because I think it provides a lot of clarity for people and healthcare executives who are thinking about this. Why I can pose this question two different ways. Why should a healthcare executive really move forward in understanding and engaging and doing this kind of work? Why should they? And what's the risk if they don't?
Yeah, I love that question. So I think at the foundational level, I think that they should seriously consider this type of engagement model because it enables them to deliver on their mission. So in Catholic healthcare, for example, these women religious that came to the United States in the 19th century, largely with the mission to find the vulnerable. These women religious were known as the walking nuns. They walked through communities to find the vulnerable, and then they engaged with them with love and empathy and guided them to all sorts of good help, food, shelter, clinical care. One of the questions that we ask when we're engaging with executives is, what if those women religious came to the United States in 2024 instead of 1824, but with the same mission? Where would they go to find the vulnerable? Well, one new place that they would go is where there are 1 billion health related questions every day.
Yeah.
And so they would go to Dr. Google and they would be there. And how would they engage? Well, they would not engage with a digital transactional ad unit to book an appointment or to have a procedure. They would engage in a dialogue. And because of conversational AI advancements, we can actually train the conversational AI to do that. And then they would guide them to good help and they would stay with them. So just in terms of manifestation of the mission, we see conversational AI properly deployed as a way to fulfill the mission. And then also, if to the extent that they're moving towards value-based care, advanced payment models, and need to be able to engage with the whole person from a financial perspective, there's a reason there. And then finally, in a fee-for-service model, there's always the need to acquire patients and retain them by delivering them the best experience. And we think that this augments all of the great things that health systems do from an experience standpoint to really cement that relationship with that consumer.
Yeah. That's awesome. That's awesome. And I think you're right. I mean, used to you would walk from house to house, but a lot of people have a smartphone or have some way to engage online. So I think there has to be a multimodal method of doing this. And so I think that's very relevant today. Yeah, yeah. Well, Andy, anything that I should have asked you that I didn't, or any other additional thoughts as we close out our time together?
Yeah, I'll give one additional thought. So there's this idea of the consumerization of healthcare has been talked about forever. And so I'm not going to talk about that in that phrase. But a lot of the work that we're doing right now with health systems is helping them understand where the consumer needs help and where they're signaling they need help. So versus where they're getting help today from the health system. So, or where they're being frustrated because the health system's not meeting them where they are and where their needs are. So I'll give you an example. In the orthopedic journey or the muscular skeletal pain journey, we find market after market after market that the volume of questions and need early in that journey with signs and symptoms is 10x where the volume is when a person is actually inquiring about specific procedural help. And yet, the competition, meaning the number of providers that are competing for the attention of that person early in the journey, is a tenth of the competition when it's connected to a imminent procedure. So
Mhm.
there's this mismatch where you have consumers that are stuck in their self-diagnosis and self-treatment of pain. They're not living the lives they want to live. They're relying on resources like WebMD or Merck manuals or whatever, which are good resources, but they keeps them in this cycle of self-diagnosis, self-treatment. But the health systems are down here fighting for that joint replacement. And
Yeah.
so I encourage the leaders that we are engaged with to consider, if you could engage earlier in the journey, and if you could engage in a conversational way. You haven't been able to do that in the past because you'd have put a digital ad unit that was connected to a joint replacement that wouldn't have helped anyway. But
Right.
now, if you can actually engage a person around their symptoms, help them understand that there is treatment, and then help guide them to that treatment, you'll get all those joints,
Yeah.
but you'll also deliver a whole nother level of value to the consumer or the community member. And that's just a shift in mindset that we're excited is used to be just a theoretical shift, but now with these enabling technologies, we can actually do something about that.
Yeah. That's super powerful. I mean, when you think about, I'm suffering now. I'm still a ways from that joint replacement. I haven't even seen a physician yet, but you're helping me in advance of that. And I would feel a great deal of appreciation, I think, and loyalty for that kind of care for myself or my family members. So
And I'm different than WebMD or whatever, because not only can I help you understand your symptoms, but I can also help you understand what treatments in your community are available, because I'm the provider of those treatments. And they may be alternate treatments, it may be digital physical therapy, it may be a host of things well in advance of a joint. But I'm helping you not just understand, but I'm helping you get to the help that you need. It's super exciting, Cheryl.
ah, that is, and and that is being, as you mentioned, good help to people regardless of how they're engaging with you today, and building that trust for the future. So I think that's very powerful, very powerful. Well, Andy, thank you so much for your time and sharing your expertise with our listeners. I appreciate you, and I look forward to talking with you much more in the future.
Always, Cheryl. Thank you so much.